Good afternoon, everyone. I'm Allison Skyberg here, Consolidated Planning Group. Thanks for taking the time to join us today. I always like to go over a few housekeeping items before we dive into the topic today. We are in webinar mode, and what that means to you is that we can't see you or hear you, but we do know you're out there, and we invite you to put your questions today throughout the presentation in the chat box, and we're going to get to as many questions as we can. We are slated today for an hour, so if you're planning your day, you can plan accordingly around that. We are excited today to be talking to Melissa Dolan and Dr. Moore from Enable Dental. This is a topic that we have not done before, and we know that a lot of our loved ones have sensory issues, and dentistry can pose a big problem for some of us out here. So they're going to be taking a deeper dive into a little bit more about who they are and who Enabled Dental is, and going to be talking to us about that. Consolidated Planning Group, we are a holistic special needs financial planning firm. We do a lot of advocacy by way of webinars and through our podcast. If you're listening today by podcast and would like a copy of the slides from today, you can email us at contact@cpgcares.net, or you can call us at 281-690-1177. Today's presentation is being recorded. Everybody who is registered is going to get a copy of today's slides and also a link to the recording. And as some of you may know, we have a Consolidated Planning Group YouTube channel. There are over 400 webinars out there on planning for special needs. If you can think of the topic, it is probably out there. And we've tried to title them in such a manner that you can search the topic for the, kind of where you are in the planning journey and act accordingly. People come to Consolidated Planning Group because they need help planning for their loved one with a disability. They need help answering questions like, who's going to care for my child when I'm gone? How much money do I need to fund a special needs trust? How and when should I apply for public benefits? How do I maintain eligibility for those types of benefits? And we help with things like that. We put lifetime care plans in place, transition planning. We help set up ABLE accounts. And again, we do a lot of advocacy. So having said that, I want to, turn things over to you, Melissa. Melissa and Dr. Moore, thank you again for being here with us today. Tell us a little bit more about Enable Dental. Melissa, we can't hear you on our end. We're having a little bit of technical difficulties, so sorry about that. We're not able to hear you, Melissa. Check your volume. Not yet. Dr. Moore, do you want to continue while we get her volume worked out?
I'll be glad to try to do that. So we at Enable Dental, or a mobile dental company, I've been doing that since 2010. So for people who it's not practical to come into an office, we come to you. We bring everything out to the field and set up wherever we can and do what needs to be done. And I've always thought it's pretty cool that we can do that coming out of private practice where we had everything in one place in one room. So to be completely mobile is quite a service that we offer, and there's a lot of need out there. Nursing facilities, um, other types of facilities, group homes, private homes, wherever we need to go, we go, and we travel hundreds of miles every week, every day actually. So it's a good service.
Is Enable Dental a national company? Are people able to get services all across the country, or is there one particular geographical area that is more prominent than others?
They're probably strongly concentrated mostly in Texas, but I know we have offices in Colorado and California and New York and Florida, I believe. So it is national and it's expanding. So they're expanding to other states and other markets. But we have a pretty big group here in Dallas, out of Dallas.
Wonderful. And Melissa says we're located in many other states across the US and are continuing to expand. So when it comes to your mobile service, I mean, I think that this is probably ideal for a lot of families, especially for families who have a loved one with some of their sensory issues or they don't like change or, high anxiety and things like that. So how is this done? Tell us a little bit about what sets you apart.
What sets us apart from what in particular?
Like from, some of there are dental practices that, that are, they, say that they are focused on special needs dentistry, or what are some of the things that you guys do? Are you able to do routine dental care? Are there other services that you can provide other than cleaning and things like that when it comes to the mobile services that you guys provide?
We can provide all dental services. We can do fillings, cleanings, extractions, dentures, crowns, whatever needs to be done. Well, to do it, I don't. I can't speak for other dental companies, but I would think they're all pretty much set up the same way. Of course, we do a lot of exams and cleanings and recall visits and then see what the need is. But normally, what we're going to do is to extract bad teeth and fill the ones that we can save. Try to keep them clean and try to keep the patient happy.
For sure. What about orthodontists? Do you guys have any orthodontists in your practice for kids that are needing braces?
I I'm not sure about that. We don't do that out in the field, and I would think they'd have to go into an office for that. So that's something to be very difficult to do mobile, but I'm sure it's possible. I'm not aware. I can't answer that question for you.
Okay, and no orthodontist at this time, Melissa says. Okay, so what about for families that their loved ones do need sedation? How does that work, or how do you guys accommodate that?
If they if if they need sedation, then we have oral sedation that we can prescribe, and sometimes that works very well, and sometimes it doesn't seem to help at all. Uh, the nitrous oxide is very useful, but we're not set up to do that. So if the oral sedation doesn't work, then they need to go to have an IV sedation at some office that would specialize in that.
Okay. So it basically, if you guys will help assisting a local provider that can help if it needs to be an in office sedation, But your mobile service is able to do like standard X-rays, those types of exams through the mobile service, is
Right,
totally able to be done. Okay.
right.
So I see about, where you guys are. It looks like there's locations all across the United States, which is exciting. This seems to be like a cutting edge approach, and definitely important for our loved ones with sensory issues. When it comes to services provided and how those services are paid for, do you accept traditional dental insurance, or do you accept Medicaid? How do people pay for the services?
Um, I know we do accept many insurance plans, and we're in the process of expanding that. We do accept Medicaid and I think Medicare services. You're asking the wrong person for that, but we're trying to accommodate anybody and everybody. There are community assistance programs that we partner with, state programs, probably federal programs. But I don't deal with that. I go out and do the dentistry part. So
For sure. That's definitely understandable. I think it's exciting. I mean, certainly, having mobile dental come to your home, this is not something that, we have been much familiar with. And as I mentioned, had never done a topic on this before. Melissa says at this time, we do not bill MCD directly. However, we have partnered with many state and federal, and then they also have other insurance programs. There's a lot of dental insurance: Delta Dental, Emeritus Dental, United Healthcare Dental. There's a lot of dental coverage out there. Someone mentioned Cigna. And is that something where they could go to your website, Melissa, and see what insurance carriers that you guys do take for coverage? Okay, so we've got a yes on that. Sorry about this. We did a run through earlier today. This is how it goes. I know Melissa is mortified. We did a run through. Everybody's audio was working. Everything was working, but some days it just goes like this. We'll pretend like today's a Monday. It definitely happens. So for some of the services, basically all of your services can be conducted either in a home or on site. And so I like the idea of like some of these facilities or residential living facilities, because sometimes some of those places the dental care is lacking. So I love this idea as well. And your licensed professionals are highly skilled and qualified to provide a range of dental services from routine checkups to complex treatments. And you have state-of-the-art equipment. So when you come on site, do you do your services like in their home, or do they come into, like I'm thinking, I know this sounds crazy, but like a mobile pet grooming services where they come to your house and your dogs go to their van and they have everything set up nicely in there as kind of like a mobile office. How does that work?
a lot of people think that, and that would make sense, but we don't do that. We don't have a mobile van that we bring people into, and sometimes that's not even a practical thing to do. So we have worked out a system over the many years that we just pack everything into boxes and bags and carry it in and set it up as we need it, and just do everything. They may be in a chair or recliner, or maybe a jerry chair, or in a bed, or whatever. We're very flexible, and so we go into the home or facility or their room or wherever we need to or wherever we can. So no, we don't have a van that we bring people into.
I love that. So, we talked about intellectual disabilities, and I'm thinking of autism spectrum disorder, things like that. Do you have the capability to work with families that maybe they're child has a G tube or has a trach or other medical devices and equipment, are you guys equipped for that as well? You're on mute,
uh,
Dr. Moore. Oh, there you
particular
go.
problem for us. Uh, a trach is one problem. The big problem for us is can they swallow? So if they easily choke on debris or fluids, then we have to be sure that we have the suction running so that we can keep that cleaned out. So that's the only issue that we have to deal with. It's not choking them, not letting them choke on water and their own saliva.
For sure. Could you go over just one more time? Someone said that they couldn't hear all of the information about anesthesia. And are you able to do local, general, or other anesthesia with this service? If you would just repeat that, because I think that's important to a lot of families.
Can you hear me?
Yes, the volume is kind of quiet. If you'll turn your volume up, I think, but I did hear you. Yes, for
Yeah,
sure.
sorry.
No worries. Did you hear the question? If you could repeat the anesthesia and what you guys can and can't do from an anesthesia perspective? I think we can hear you now, Dr. Moore. Can you hear us okay on the anesthesia question? Okay, so Melissa says at this time we only do oral sedation. If a client needs general or IV sedation, we can assist by locating a local dentist that would be able to meet those needs. Someone is saying that they can't hear anything. If anybody can hear us, can you just put it in the chat box? I am so sorry for today's technical difficulty. We generally do not have technical difficulty. It's kind of one of those days. Someone says I can only hear Allison. So, okay. No sounds from the doctor, only Allison. So I'm sorry for that, guys. So let's talk about some of the billing options here at Enable Dental. We kind of talked a little bit about maybe some of the programs and insurance programs, and Melissa had mentioned that on their website that you could find like the insurance that they bill. They're currently billing directly through these Medicaid waivers, HCS, Texas Home Living, and ICF clients. They have cost-effective plan where they have specialized plans designed for the unique needs of ICF. They also welcome private pay who wish to pay for their services directly. And they're actively working on partnerships to expand coverage options. They're working on becoming a Medicaid provider and are currently in negotiations to achieve this. And they currently accept United Healthcare and can utilize I want to make sure I make that clear, Medicare Advantage benefits for qualified patients as well. And they're continuously adapting and growing their services to meet the needs of the IDD community. So it's important to know that that when it comes to these services, it's not all private pay. They do accept insurance. It's not a lot of times in our community when it comes to services for a loved one with a disability. As parents, we're often charged of paying everything out of pocket. It's not good news. It's not covered by insurance. We hear that all the time, and for many different factors when it comes to our child's care. So I think that this is awesome, and I love that you guys are trying to expand that to Medicaid as well. So Enable Dental, they have a website. You guys are going to get a copy of today's slides today with the links. I sincerely apologize for the technical difficulties today. Honestly, we totally did this. It totally worked. There was no issues. And sometimes that's just how it goes. But the message is loud and clear. We've never done this presentation before. Enable Dental is awesome. They are a mobile dentistry company. They come to you, they come to the facility, they bring the supplies, they can do the oral sedation. If your child needs or your loved one needs more extensive sedation, then they will make a referral out for that. They take many insurance programs, including Medicare. They're working on Medicaid. They also have private pay options. So if dental issues have plagued you in the past with your child, Enable Dental may be a company that you want to engage their services. Melissa Dolan is awesome, although we couldn't hear her today. And so for the contact information, we're going to have their contact information in the slides. Everybody is going to get a copy of today's slides and a link to the recording. They'll have their website. It'll have Melissa's email as well as her contact information, so you can contact them directly to learn more about how they may be a fit for your family and your loved one. So when it comes to planning, we also, we always say this, at the end of all of our webinars. Again, Consolidated Planning Group, we are on the train of advocacy. I am a parent before two with special needs and that have graduated into adulthood. And what I would say is planning for their future has been difficult at best. And I eat, sleep, and breathe this. This is what I do all day, every day, and it's tough. So we have a lot of webinars out there to learn. They were talking about that some of their programs are covered by Medicaid waivers. We have entire webinars dedicated to Medicaid waivers. What is out there? How do you get on the list? How do you get a Medicaid waiver? SSI, SSDI, we're nationally certified as Social Security advisors. So if you've been getting letters, been getting denied, you haven't, but you want to know how and when to apply, we can help you with all that. ABLE accounts, these are places that you can have money above and beyond the $2,000 Medicaid limits, which is the Medicaid limit for the state of Texas and most states, not including California. But an ABLE account is a place that you can have money above and beyond that will not be counted for SSI and Medicaid purposes. When we have a loved one with a disability, their situation is specialized. And a lot of things didn't matter prior to them turning 18, but when they turn 18, everything changes. Making sure that we have money in the right buckets, preserving that eligibility for state and federally funded programs, understanding the special needs trust. What is a first party special needs trust? What is a third party special needs trust? This is yet another place that we can have money above and beyond the Medicaid limits that will not count against them for those benefits. A lot of people are considering guardianship in the state of Texas and a lot of states. It's basically the law says the least restrictive, most appropriate for the individual is what is allowable. So there are such things as full guardianship, which is going to take away their right to drive and their right to vote. There are things as partial guardianship, which they may retain the right to drive and the right to vote. And then there's less restrictive options like a power of attorney, a healthcare power of attorney, or something called a supported decision-making agreement. And we have lots of webinars on these topics because I know when we're coming around the bend, our kids are turning 18, we start feeling nervous about these things and not knowing what we don't know and what is the right decision. So there's a lot of help for you out there that's going to be on the Consolidated Planning Group YouTube channel. And so you can kind of look at those, and we'll have upcoming webinars in the future. So one person says, Okay, so Melissa says she's sorry that everything wasn't working today. I know she's she's mortified that this went down this way. But she says please contact her directly. She'll be happy to answer any of your questions. And she also is a parent with a loved one with a disability as well. Someone says, does the team at Consolidated Planning Group have staff that can give a service to a PCP in the team that serves only CYSHCN? I don't know that acronym, so you'll have to clarify that. We do provide services to both providers and organizations that serve the special needs community. We do a lot of advocacy. We do a lot of educational webinars and educating both families and professionals of the next steps that families need to take. And you can reach out to us directly at contact@cpgcares.net, and we can talk to you further about your organization's needs. One person says, our disabled daughter had an anxiety attack at the dental office environment in the past. They would not proceed with her, but she is very relaxed at home, and we think that this type of service would be a great help with her relaxing. And I'm sorry, and are very interested in this types of service. Thank you for providing this information. And someone said, oh, children with youth with special needs care. Yes, we do, again, a lot of educational, we do a lot of transition talks on what are the next steps. We have a presentation that's called the key steps for special needs success. We have transition webinars. We have webinars on what are the options out there post high school for our kids with intellectual disability. We talk about transition programs, residential living programs, all types of different higher education with the community college as well as the university. So we have all kinds of programs like that. And the thing is when we think of the term transition, oftentimes the term transition is really thrown around, Dr. Moore, with when it comes to medical care and kids aging out, turning age 18 or age 21. But the transition term, when it comes to planning for a loved one with a disability, the transition is really, really broad because of there's so many things that need to be taken into consideration. The thing is as parents, we're not always going to be as spry as we are right now, right? Of sound mind, sound body, totally able to be the caregiver and do the things that you've always done for your child. And so it's planning for the future of that when you are of sound mind and body, for what does the future look like? What does the future look like when I'm no longer able to provide those services? What if I'm no longer here? But what if you're a family that wants some autonomy for yourself and autonomy for your child, and you want them to have the best life that they can have? You want them to have community. Maybe they want to have a job. Maybe they want to have some type of semi-independent living situation. We have webinars on all of those topics. So you're going to get a copy of today's slides. And this link right here has our upcoming webinars that you can register for as well. We work on a collaborative team here at CPG. We're nationally certified as Social Security advisors, members of the Special Needs Planning Academy, and we stand ready to help you plan for your loved one with a disability. We offer free personalized consultations. So if you've had questions today, if our things that should be on your special needs planning radar has kind of got your flags up of, hey, I need help with this, whether you've done a lot of planning, you're just getting started, or you did some in the past, but you need to pick up where you left off, we can definitely help you. Our free personalized consultation is designed to talk to you a little bit more about the planning that you've done so far, understand what brings you to the meeting and answer the questions that you have, and share a little bit more about who we are, how we work, and the various doors that you can walk through with our organization. It has certainly been my pleasure to be here with you today. It's been my pleasure to be here with Enable Dental, Dr. Moore and Melissa Dolan. Again, we apologize for the technical difficulties. It definitely happens. It's just the world that we live in nowadays. But I think we got the message loud and clear of who Enable Dental is. And I know that there are a lot of people out here today that are pretty excited to learn about your services, and will be reaching out directly to you, Melissa. If do we have any additional questions? Yes, we will send the videos. Someone said with the technical difficulties, we appreciate sending the video. We're going to send you a copy of the slides with any of the links in it, as well as a link to the video. And as I mentioned earlier, the Consolidated Planning Group YouTube channel, all of our past webinars will live on that YouTube channel, so you can peruse some of the topics. If we were talking about guardianship or able accounts or something like that, and you want to learn more, you can check that out there. Thanks, everyone. It's certainly been my pleasure, and we'll look forward to connecting again soon. Watch out for our email. Have a great afternoon. Bye now.